Welcome to the Sunshine Training Center. In a previous video, we discussed why it is important for burn patient to wear pressure garments all day, and also covered 3 important factors to consider when planning wear schedule. In this video, we'll discuss how the therapist can help prepare the patient's transition towards discontinuing the use of pressure garment, and how to deal with concerns, anxiety, and fear that may arise when patients have difficulty letting go of their garments. 4 tips, how-tos and videos on burn rehabilitation. Be sure to subscribe to our YouTube channel or visit our blog at www.sunshinetraining.org. This video was prepared by Yuli Sung, physical therapist and director of the Medical Device Center of Sunshine Foundation. First of all, although many patients may find it very liberating to finally be able to discontinue the use of pressure garments, it's possible that some patients may be reluctant to do so. Although the therapist has assessed that scars have reached maturity and there is no longer a risk of hypertrophic growth, some patients may still worry that without pressure garments, their scars will continue to grow. Some may get a feeling of protection and security from the garments. The garments not only protect the skin from the outside environment, but they also cover the scars and hide them from view. Removing garments implies revealing one's scars, which can be emotionally challenging. Also, after wearing garments for many months, even years, they've become like a second skin for the patients and are part of their daily routine. The first step is to determine that pressure garment use can be safely discontinued. Pressure garment use can begin to be safely discontinued when scars are mature or almost mature. Although time since injury can be used as a reference, because every patient's scar maturation speed is different, the therapist can assess scars based on the following criteria. Vascularity. Is the color closer to normal pinkish skin color? Height. Does the scar look flatter? Pliability. Is the scar suppler? Can it be pinched and raised more easily? Another thing to observe is whether the scar remains flat even when the garment is removed. If the scar is still active, it will tend to rebound and rise again after the garments have been removed. If the scar is more mature, the scar's height will remain the same even after garments have been removed. Second, help the patient prepare through progressive reduction of use. If assessment finds that the scars are close to maturity, the patient can progressively ease out of his garments by reducing the number of hours of wear in half to about 12 hours. The therapist can discuss with the patient when is the best time to remove the garments during the day, based on daily routine. It's also possible to start reducing use for one specific area of the body or a specific garment, and then progressively include other areas or garments. It's important to remind the patient to observe closely how scars react to reduction of pressure garment wear time, and also schedule follow-up with the patient to monitor scar status and adjust the strategy accordingly. If the patient seems worried or anxious about discontinuing pressure garment use, the therapist can discuss with the patient what is the source of his anxiety and together, identify possible strategies to facilitate the transition. For example, if the patient fears that scars will continue to grow once he stops wearing garments, the therapist can explain the scar maturation process and show the patient's progress with photos of scars and scar evaluation results over time. Tangible proofs can help the patient visualize his progress and lessen his fears of hypertrophic scar growth. For example, the therapist can show the patient how his Vancouver Scar Scale scores become lower over time as a sign of scar maturation. If the patient is not ready to show his scars and fears everyone will notice them, he can wear long sleeves or long-legged pants in the meantime. The patient can then try to progressively get used to showing his scars by wearing short-sleeve shirt at home for a short while, then for a longer period followed by short periods outside, and so on. The patient can also prepare short answers to potential questions from curious strangers or imagine what he would do under different types of scenarios. However, if scars cause body image issues that risk affecting the patient's emotional well-being or even his return to a normal life, it may be a good idea to encourage the patient to talk to a psychological professional. To summarize, make sure that scars are mature or close to maturity before discontinuing pressure garment use, by looking for specific signs like vascularity and color, height, pliability, and scar rebound. Discontinue use progressively, both in terms of increments of time and in terms of body area or specific garment. Reduction of use should be accompanied by close follow-up to monitor scars. Explain reduction of pressure garment use with the patient and discuss any possible worries. If the patient feels anxious, discuss the source of his anxiety and together, identify possible strategies. Thanks for watching and don't forget to like, comment, and subscribe for more professional tips.